Hello there, my name's Simon Kempton, and for the last few months I've been the lead for the Police Federation on the COVID-19 response. I just wanted to take a little bit of time to explain some of the things that the Federation's been doing on your behalf for you across the country. So at a national level, we started to work very quickly with chief officers, with the Optala team and with government around the main issues for the frontline officer. Things like testing of COVID-19, PPE, which was our biggest issue right at the beginning, and about ensuring that forces start to do things differently to protect both us and the public. So we highlighted the issue of PPE, helping to put in place processes so we could get the PPE to the front line when it was needed, quickly, and it was the right standard of PPE. The issue of COVID-19 being weaponised was massive for us, so we worked with the Home Secretary and the Home Office, and we highlighted it through the media to try and ensure that the courts were handing down sufficiently harsh sentences. One of the first things we were able to do is positively influence the guidance for forces around officers self-isolating or caring for others, which meant they couldn't come into work. And what that meant was the guidance actually reflected a higher standard, a better standard, that, for example, if you were self-isolating, we made sure that it didn't affect your Bradford factor scores, it didn't affect your personal record or your sickness record. We've issued some guidance around mental health resilience. My colleague Shay Donald with Dr. Jess Miller put out a video recently, and we've worked with the Oscar Kilo team through the police resilience team to make sure that there's guidance out there that we can signpost people to through what is a really difficult time. My colleagues have been working on their own portfolio areas constantly, things like the custody, things like conduct, things like working with the College of Policing, to make sure that no matter what stage of your service you're at, the Federation is supporting you and protecting you. So a good example of that is working with the forces around recruitment, keeping our new recruits safe but making sure we can still recruit so we can still get the uplift of officers. And at a local level, just as importantly, Fed reps have been working with gold commanders and silver commanders, influencing things like shift patterns, influencing things like the way that we respond to calls. It was really important for us right at the beginning that we made it clear it's not business as usual. We do need to do things differently to keep ourselves safe, to keep the public safe, as we go about our job protecting the NHS. So the Federation's been your voice with senior officers locally, and we've made practical differences. Colleagues up and down the country organising PPE deliveries and organising the way that PPE is used to make sure it's not wasted so that it's there when we need it. Federation welfare vehicles delivering not just PPE but refreshments and other advice. One of my colleagues recently organised a dial-in for the Chief Constable so that officers could put their questions to him directly. We seem to be getting towards the end of the peak of the outbreak now, moving towards a phase where we look at recovery and going back to some sort of normality. So there's still some tough times ahead. And what I'd say is, please, if you've got any concerns, any questions, anything that you need from your Federation, contact your local rep, contact your local branch. But more than anything, please, stay safe and look after each other. All the very best. Bye-bye.